Swelling is a broad term with different distinguishing clinical features, and one should always seek emergency care if sudden, unexplained swelling occurs in body region. To deal with all such cases, we are going to discuss the differential diagnosis of swelling in detail. So the first thing is to be familiar with term swelling, which represents as growth or distension in a region of the body, sometimes painful. Then you should be familiar with the factors which make swelling worse, including menstruation, certain positions, injury, drugs, certain foods or dust, time of day, pregnancy. If the swelling can be described as a lump and is located in your neck, under the jaws, around ears, around collarbone, elbows and underarms, behind knees, and in groin, the lump is likely a swollen lymph node. Swollen lymph nodes can occur because of injuries or diseases such as those affecting mouth, teeth, and lungs. Now there are some important questions that you need to ask your patient before making a diagnosis. You will ask your patient what symptoms of disease they are experiencing, including weight change, shortness of breath, yellowing of skin, itching, tenderness, redness, aching in swollen area, chronic loose stools, abdominal pain, chills, pain, fever, rashes, results of a recent EKG or chest X-ray, outcomes of tests of kidney and liver function, and discharge or change in appearance, like a lump. Now, you will ask your patient if they and anyone of their family have these diseases, including heart disease, kidney disease, varicose veins, anemia, bowel disease, liver disease, allergies, past injury or surgery in the swollen area, tuberculosis, mononucleosis, sore throat, recurrent infections, sexually transmitted disease. Now you will ask your patient about his diet and exactly where they are experiencing swelling. One more important question you need to ask the patient is if they have swollen lymph nodes. You will ask if they have recently received any vaccinations or been exposed to measles, mumps, chickenpox, or sexually transmitted diseases. You will ask the patient if they are taking any of these medications, including diuretics, steroids, birth control pills, nifedipine, digitalis, diphenylhydantoin. That you are well aware of the symptoms of your patient. Your main role starts here, because you have to examine the patient. Well, this physical examination includes temperature, blood pressure, pulse, listening to your chest and heart with a stethoscope, pushing on abdomen, thorough neck exam, looking at legs and arms for swelling, and weight. If patient has a lump, you will examine the lymph nodes and check the lump and for size, consistency, and tenderness. Now, what can cause swelling and what is typical for each cause? Well, there are different causes of swelling which we are going to discuss. If the patient shows symptoms like bloating, weight gain, mild swelling, then this might give you an indication that patient has cyclic swelling in females. Well, this is bloating and body changes that follow menstrual cycle. But if your patient has typical symptoms like swelling, weight gain, then this might be an indication to medication use. Well, medication use causes swelling or weight gain. But what if your patient is having swelling around the infection site, warmth, redness, tenderness in skin? Then this is an infection caused by invasion of a pathogen. If the patient has symptoms like diarrhea, enlarged abdomen, poor diet, weight loss, well, this is hypoalbuminemia, which is a decrease in particular protein in the body. But if your patient has typical symptoms like pale skin, shortness of breath. Then, this might be an indication to anemia. Well, this is deficiency of needed substance in the blood. If your patient has typical symptoms like sudden swelling, occur after injury, exposure to particular food or dust, infection, severe shortness of breath, then this might be an indication to angioedema. Well, angioedema is allergic disease in which you develop welts on skin. Now, if the patient shows symptoms like cancer, history of heart disease, kidney problems, history of liver disease, then this might give you an indication that patient has ascites. Well, this is an abnormal collection of fluid in the abdomen. Now, if the patient has history of kidney disease, history of liver disease, trouble breathing, history of heart disease, then this might give you an indication that patient has organ failure. Well, organ failure is failure of heart, kidney or liver to function properly. Now, if the patient shows symptoms like high blood pressure, occurs only in pregnancy, then this might give you an indication that patient has toxemia of pregnancy. Well, toxemia of pregnancy is a dangerous condition of high blood pressure in pregnancy. If the symptoms are swelling in extremities, may occur after a tumor or surgery, radiation treatment, infection with a parasite, this might give you indication that patient has lymphatic blockage. Well, this is a state of a block in the vessel that drain fluid from tissues and transport immune cells around the body. Now, if the patient shows symptoms like swelling, chronic aching, purple-brown skin discoloration, night cramps, itching, then this might give you an indication that patient has venous disease. Well, venous disease is problem in vessel, such as inflammation or blockages. Now, what can cause lumps or swollen lymph nodes? Well, if the patient shows symptoms like tender and warm area, skin rash, fever, then this might give you an indication that patient has infection. Well, this is invasion by a virus such as German measles, mumps, mononucleosis, chickenpox. And lastly, swollen lymph node or lymph can also be caused if the patient shows symptoms like infection, weight loss, fever, bleeding. Then this might give you an indication that patient has malignancy. Well, malignancy is abnormal, unchecked cell growth. So now, if you are clear about your findings, you can manage your patient accordingly or do further investigations if required.